UrbanBroadcastMedia.com Chicago.
And around the world where your voice is heard. This is UBM Talk.
Hello, this is Reverend Rick McCain, and I'm here with my baby, my girl, my boo, author Brenda McCain, and we're the hosts of the Let's Stay Together show.
That's right, baby, where you learn the rhythms of all relationships. We are bringing Holy Ghost fun to the internet and changing the way people communicate about quiet storms within their lives. We believe that to know our glory, you have to know what, baby?
Our backstory.
So come and take a ride on the McCain train every Tuesday from 8 to 9 p.m. Woo woo!
A Vibrant Mix is back with a new format.
Same informative and vibrant topics.
And a new co-host.
Yep, we heard you, and Cousin Fred is on permanently.
Hey, this is Fred. Join us every Friday from noon until 1. Same great conversation, same vibrant mix.
A Vibrant Mix with Tasha
and Tamiko
and Fred.
Right here on UrbanBroadcastMedia.com.
Lord, how did I get in between T and T?
Watch out, Fred. We're explosive.
Have you ever seen grandparents who are always on the move? Well, let me introduce you to Mr. Lorenzo Young, Miss Hermeline Jones, Miss Lenora Lusk, Miss Rose Henderson, Miss Doris Riley, and yours truly, Marie Johnson. Join us every Saturday morning from 11 a.m. to 12 p.m. on UVM Talk. Grandparents on the move, we don't rock, we roll.
The Damon Williams Show.
We went to our set up Arsenio. We were in the audience. Anytime you see a white woman with a clipboard, chances are that person's going to be on TV. They're going to put a little dab of whipped cream here and here and here. That heifer squeezed that whole damn can of whipped cream all over my face. And then after she licked it off, my little dirty old man neighbor, who never has two words to say, I look out, he's standing at his Sunday best. So you like whipped cream, huh?
The Damon Williams Show, Wednesdays, 2 to 4 p.m. on UBM Talk. Worried about paying your light bill? CARE programs offer help so you can stay in the light. To see if you qualify, visit comed.com/care or call 888-806-CARE.
ComEd presents the power of staying in the light. Having trouble juggling all your bills? Are you worried about the lights getting turned off? ComEd Care programs can help you keep the lights on. Care programs offer help to those facing financial hardships. All inquiries are confidential. To see if you qualify, visit comed.com/care or call 1-888-806-CARE. ComEd, powering lives. Grant amounts may vary while funds are available.
The following show is paid programming and does not necessarily express the views and opinions of Urban Broadcast Media and its subsidiaries.
Thank you for listening to UBM Talk.
Hey, 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 it is Dr. Shanika Williams here for the Diva MD show. Oh my God, OMG, I missed each and every last one of you guys. Yes, I took a little sabbatical, so what? I got to do it sometimes, right? And look what happened out of that sabbatical. I have moved to a new time and space, baby. Yes, we are now every Saturday from 3 to 4 p.m. only on UBM Talk. Can I get a amen? Can I get a snap? Can I get a clap? And all that good stuff. I am happy to be here. You know, it's probably a better move, too. Y'all was probably trying to, on a Friday night, go out and kick it and drink and do all that bad stuff and trying to get your health on. How about you turn up to get your health on with me every Saturday, 3 to 4 p.m., okay? We're going to try something a little bit different. Thank you guys for joining me again. Like I said, I completely missed you all. And, you know, we have a very, very special show today. October is Breast Cancer Awareness Month. And we have some phenomenal people in the room with me and on the phone. And you know what? I have to give this young lady her proper introduction. Her name is Dr. Vikisha Fripp. Okay? She is a double-boarded plastic surgeon, okay? Her double boards are plastic surgery and general surgery. Man, this woman is bad. Let me read this to you, okay? Because then you all understand where I'm coming from. She is a diplomat of the American Board of Plastic Surgery. She's a fellow of the American College of Surgeons, and the International College of Surgeons, a member of the American Society of Plastic Surgeons, Women in Plastic Surgery Steering Committee, Women in Surgery Committee, and Association of Women Surgeons. She's certified. That's all. I put my stamp on it right now. Boom. Dr. Fripp, are you on the line?
I am.
Hey, Sunshine, how are you?
I cannot complain. It's a great day.
Yes, it is. Did I do you justice?
You did. I was looking for the person in the room.
Is she talking about me? She can't be talking about me. Yes, you are a bad African American woman, and I love it. Congratulations on all your compliments.
About you. Thank you for having me.
Oh, thank you. So you know what? I talked a little bit about your educational background, but tell us a little bit more about yourself and how did you decide to go into medicine and go into your particular field?
I hail from Atlanta, Georgia. I am a true Georgia peach living in this cold Washington, D.C., but I love it. I went to Fisk in Nashville and then went on to medical school at Meharry. Somewhere in that process, I decided I wanted to be a surgeon.
Oh, wow.
I didn't know what kind of surgeon. Trauma intrigued me. Plastics intrigued me. So I went to the Mecca of Medicine. This is Howard University. I had a wonderful experience at Howard, but I knew early that trauma was not it. I wanted to deal with people who were healthy but had some major issue that required surgical intervention and needed a real person to walk them through it, someone who was compassionate, and someone who could be on the other side. And we could all be impacted by all the things I treat on a daily basis.
Absolutely.
And so I love what I do. I am a mother of 3 under 3. So
oh my gosh!
My home.
Did you just say that?
I have a 3-year-old and I have 19-month-old twins.
Oh,
and
wow!
So we are a carnival.
I can believe it.
Every time we go out.
How do you balance?
You know what it is? I have a lot of help. My husband is awesome, but we ask for help. We have a babysitter. And then our schools know our predicament, and so they all pitch in to create a village around our kids. And then we're blessed with being older parents, so things that I guess would bother me in my 20s and maybe early 30s, they just don't bother me the same way.
Sure.
And so we know that we have children, and that's our blessing and also our task. And so we just try to exhale, not blame each other, and not make too many plans.
Because they will be foiled. I got it. I got it. So just so you guys know, some of her interests are body contouring, especially after massive weight loss, cosmetic and reconstructive breast surgery, which we'll definitely get into, and some non-surgical enhancement of the face and eyes. So I'm very excited about what you do, because you actually really help women who, especially after weight loss, you have, the extra skin and, some things that just women want to feel beautiful and whole. So, you play a vital role, especially in women who've had certain diseases and certain complications. And I definitely applaud you for that.
Thank you.
So let's get into the nitty gritty. Let's talk about, the ins and outs of breast cancer. You want to just go ahead and just give me a general overview of what breast cancer is and what that means?
It's a very unfortunate disease because it will happen to 1 in 8 women. So if 7 women, 1 of you will be affected by the disease. And we know that women of African descent have a worse grade when their cancer is detected. And that's what our mission has been in the country, probably in the last 5 to 6 years, is encouraging women to participate in early detection so that their cancers are being cured because they're happening early. So I had a 21-year-old with breast cancer.
Oh, wow.
I've treated women in their early 30s. So think about where you were in your early 30s. You're just finishing school. You're just knowing yourself. You're waiting for the rest of your life to develop, and then you get this breast cancer. But I tell my patients it's not the end of the world.
Right.
We didn't choose to have it, but we can walk this road together to get this disease cured. And then I am like the rainbow at the end, because the treatment for breast cancer is to be curative. Once you are cured, though, you still want to have a breast mound. You still want to have breasts. The old thought was, let's cure the patient of the breast cancer and not worry about how the breast looks afterwards. And so your grandmother, your great-grandmother had a mastectomy, her breast removed, and either wore prosthesis in that prosthesis in that bra, or had no reconstruction. And so things have changed. Women are being diagnosed earlier. We're treating them. And so we're making incisions that are cosmetically friendly and aesthetic so that they're not ashamed to wear bathing suits, to be intimate, to show their body in any way. And so what we do now is I encourage my patients to know their breasts. You see your physician, if you're lucky, once a year. There are 11 months in the interim. You need to do a self-breast examination every month so that if you feel something different, you're not waiting for your turn to see the doctor.
Right.
Go in, even if it's nothing. Let your doctor know. Let them prescribe the right intervention. You have a diagnosis, and you move forward. Believe it or not, knowing is much better than not knowing.
Absolutely. And you bring up actually a couple of really good points, and I actually have a two-part question for you. One is, why do you think we're seeing cases earlier? And then, as far as age in women. And then the second part is, we know that African American women have a higher morbidity, so they are more likely to have a poor outcome if they're diagnosed with breast cancer. However, the majority of women that actually get breast cancer is Caucasian women. So, what's the difference?
Those are great questions. The first one is, why are we finding breast cancer earlier? And the answer is because we're doing screening. Before, we didn't do screening of women. We didn't encourage self-breast examination. And so we may have had those same cases, but we didn't know because we weren't screening it. Just like the incidence of colon cancer have increased, prostate cancer. Well, now we're screening people's colon, we're touching people's prostate. And so we know when there's something different, and that's why we're detecting them. The second part is really one of those issues that sticks in my craw, which is it's not being studied. So we know African American women have a more advanced stage when they're diagnosed, but we're not being studied. So there are no ongoing research efforts to figure out what it is. We can only assume clearly that it's genetic, because you're right, Caucasian women make up the predominant population who have breast cancer, but they're the ones that are already being studied.
Right.
And so, you won't know that answer unless you study. But the flip side of that coin is, traditionally, African Americans are not very participative in these research studies. We have a history of distrust. And so even if someone were to give the money, set up the institute, because there's a woman in D.C., Dr. Lucille Campbell Adams at Georgetown, who runs these kind of studies, but the problem is people don't trust the studies, so they don't sign up. And so we just need to do the research, and we have to trust that in order to figure out what exactly is the difference. We have to be studied in a way that's an unbiased, randomized trial.
And then speaking of detecting breast cancer at earlier stages, what are some of the screening modalities that we use? And talk a little bit about what risk factors we have.
That's a good question. And so we know that age is one of those risk factors, in that as we get older, breast cancer risk increase. And so the thought was, you had a screening mammogram. This is not a diagnostic. This is a person who is not thought to have cancer, goes in for a screening mammogram at 40, and then every year after that. Well, the U.S. Task Force said, you know what? You could probably wait until 50 and then get a mammogram every other year. Well, that was met with a lot of just anger.
Absolutely.
Because you would miss a lot of women if you put it off to 50. So what I tell patients is to just be your own advocate. Tell your doctor, I want to get a mammogram at 40. This is if you have no risk factors. And then I'll decide whether I'll get it every year or every other year. It'll be based on what my mammogram looked like. If it was clean, no calcifications, no findings, then maybe I will wait every other year and I'll screen myself at home by doing a self-examination. If I'm anxious, it worries me, then I'm going every year and get a mammogram. So the other risk factors, of course, are a personal history of breast cancer. If you've had a lump or a breast cancer before, then you're at increased risk for having it. If you have the BRCA1 or BRCA2 gene, you have an increased risk of having breast cancer, as well as other female cancers. If you have more than your fair share of radiation exposure, that puts you at increased risk. And that's like chest wall radiation as a child or a young adult. This is what we don't want to hear, but obesity. Nobody wants to hear anything about weight control. And, we just turn our ears off and we'll have that discussion. And then being on your menstrual cycle at a younger age. So if you started your cycle before 12, that's a longer time that you would have a menstrual cycle, and so you're at increased risk for having breast cancer. And then having your first child after age 35. And so that's me and most of my friends. But that's just the reality of, breast cancer. We make certain decisions in life, and then we look back and say, wow, I didn't know that. So those are some of the biggest risks. And then having never been pregnant. And so these are risks that we stratify in the office. We have a questionnaire, and then we try to catch as many people through that questionnaire as we can.
Yeah, that's pretty interesting. Just listening to those risk factors, I'm like checking off all my stuff. I'm like, shoot, I don't stand a chance. Jeez. But okay. That's all right. So having said that, what can women do to kind of go, be in prevention mode?
Right. And so what I always tell patients, remember, when we talk about weight, and it's a very uncomfortable discussion, but when we say BMI and we say that you're over your BMI, just take it as a frame of reference, because patients always push back and say, I wasn't that weight when I was in high school. Well, in high school, you were already in trouble. And so then I tell them, be as close to your recommended weight as possible. Now, that does not mean to starve yourself or do anything drastic, but make a lifestyle change.
Absolutely.
I am not advocating for anyone to go out and just have a child that you won't have breast cancer, because that's 18 years of responsibility. Those two things are not congruent. They're not. What I am saying is all the environmental things that go into breast cancer, try to control them. So we talked about weight. You know that you need to exercise, avoid excess alcohol, avoid tobacco. And then, again, if you know your body, you'll pick up on things before your physician does. We have handicapped patients in America to depend on the physician. You can be a police of your body at home also. There's nothing that will ever appear on my body that my doctor will tell me, because I know every part of my body.
Right.
And I don't like every part, but I know it, and I'm familiar with it. And so that's what I try to arm my patients, to take that power back, and as much as they can, control the environmental factors, the things that we can change. You can't change your age. You can't change when your cycle started. You can't change those things. Your family history, your genetics, those things can't be modified. But the things that are within your control, make a decision to put yourself first and to be important to yourself.
Absolutely. Thank you so much, guys. If you all are just tuning in, you are listening to the Diva MD show with Dr. Shanika Williams. And on the line, I have Dr. Vikisha Fripp, who is currently residing in Washington, D.C. She is a double board certified plastic and general surgeon. We are talking about breast cancer today and some of the risk factors. Are there any symptoms that women should look out for?
Yes. I'm so glad you asked that. I had a patient on Friday who said she noticed something in her breast and ignored it for 4 years because she didn't think it was anything. And so my whole thing is, it wasn't there before that 4 years ago. So any change in your breast, if you feel an irregularity or firmness, if anything in your breast becomes tender, though in general, breast cancer is not a painful disease, but if you feel something and it's tender, if you feel any firm nodules in your axilla, under your arm, those are things you need to be talking about. Nipple discharge outside of pregnancy is not normal. And so those are things you need to bring to your physician's attention. If you notice that one breast is getting larger and the other is not, you know that your bras don't fit the same, do an examination of your breast at home, or if you just don't feel comfortable at all, make an appointment to see your doctor and have them do an examination and show you how to examine yourself.
Going to the doctor is huge, right? A lot of us kind of shy away from going to the doctor, especially when we really feel like something is wrong, right? So
you know what it is? I think that more so than being fearful of the doctor, we lose our voice when we get to the doctor's office. And that's the problem. We can make an appointment, but when we get there, if they say anything that just puts us off, we let it go.
Right.
We just won't say anything else. And I don't let my doctors off that easy. They already know to exhale when I come in the room. We may be there for a minute. You know, I may have questions about things. You know, and I don't mind asking questions. Right. I arm my parents as well as some of my older friends with a journal, and we go over questions that they should ask. And this is not like extemporaneous questions like, why is my hair brown?
Right.
These are in-depth questions that only a physician should be able to answer.
I just actually incorporated the same thing in my practice, giving out little journals so that they'll be able to ask questions and give questions, you know. It's just, you have to be active in your care, period.
Yes.
So let's talk about treatment. Like you said, we're in a new day and age, and, you know, mastectomies are you can still get a mastectomy, but there are things that you can do to kind of augment that breast contour again. So you want to tell us a little bit about some of the treatment modalities for?
Yes. Now, if you meet the qualifications to have what's called breast conservation therapy, that means that we do not have to do the traditional mastectomy. So we'll go over the breast conservation first. And what that typically is removing the area where the cancer is, doing radiation, and having chemotherapy. With that procedure, you should retain the contour and shape of your breast. However, if the breast mass is on the inside of the breast, above the areola, then removing tissue in those areas tend to distort the appearance of the breast. And in that case, the plastic surgeon like myself will come in and either reorient the tissue or put what we call a tissue expander, which in layman's terms is a spacer. So as the breast heals, it heals with the shape. Okay, so that's breast conservation therapy. That's retaining your breast, just removing the area. Even if you have to have a mastectomy, which means you meet all the qualifications to have the mastectomy, they can't save your breast. Gone are the days we make this horizontal incision across the chest. So you wear this scar that tells everybody you had your breast removed. We are now doing nipple-sparing mastectomies. We are now doing incisions that are below the areola. So you are still able to wear a collared shirt, a V-neck, a swimsuit, a wedding gown, a divorce gown, whatever you want to wear. Okay? Because there is no reason to have that horizontal scar across the breast.
Sure.
And so what I typically do is, regardless of what my patients are getting, I meet with them before. And so if they're having a mastectomy and we're doing something like tissue expanders, it is a very simple procedure for me to see them the day before surgery and do the proposed markings in my office. That way the surgeon has a guide. Okay. If we're doing something else, like we're using that extra, what I call love tissue that we have in our lower abdomen, because typically it results in having a child or living a very happy life.
Those handles.
And so we use that love tissue, and we move that up onto the breast mound and create a breast out of that tissue. It's your own tissue. It ages with you. It feels like your regular tissue, and we can more so match the opposite side if the opposite side was not removed by using your own tissue. We also are able to use tissue from the back, the butt, the inner thigh. So we have areas where we can borrow tissue from to create a breast. But we have to always make sure that the goal of treatment of breast cancer is to achieve cure. Once we do that, talk about making breast. But I don't want to confuse patients by thinking that we should be talking about breast reconstruction before we talk about treatment.
I see.
And then I have a lot of patients who come in and they've heard things about chemotherapy, and they say, well, I don't want to lose my hair, so I'm not going to probably get the chemotherapy. And I honestly can't accept that. I reject every patient who says that.
Oh, wow.
Because if losing your hair is more important to you than losing your life, then we have to start over. I have to push the reset button. Because there are things we can do, like a cool cap you can wear during your chemotherapy to keep your hair. Even if you lost your hair, there are some wonderful wigs. And so we refer our patients out to be seen by stylists so that they can get the wig that's going to be the best for them. So we want patients to embrace this process, know that it's not fair, but you can get to the other side and be a survivor.
Yes.
And to share your story with other women.
Absolutely. And when you say that, I have 3 beautiful women sitting right in front of me who are ready to share their story on the next half of this show. So I'm very excited about that. You know what, Dr. Fripps, this has been absolutely amazing. I thank you so much. I wish we had more time to hang out with you. And since this is the Diva MD show, and I'm going to get your plastic surgeon opinion, but I do diva-isms, and I did one specifically for breast cancer. So you tell me if this is all right. Because I'm going to tell my patients this, okay? So D, detection, annual mammogram. Simple. I, inspection, self-breast examination. V, visual changes, dimpling of the skin, you know, that orange-like peel, that roughening. And A, ancestry, family history, first-degree relative with an increased risk of breast cancer. That sound okay? My diva-ism okay?
I love it. You nailed it.
And since you are such a fabulous diva yourself, Diva also stands for discovering your innermost valuable assets. And in the last minute and a half that I have you on my show, can you please tell me what makes you, what are your innermost valuable assets? What makes you you?
I am self-aware. And I think because of that, it allows me to touch a lot of people regardless of where they're coming from, regardless of where they've been, and regardless of where they want to go. Because I can change depending on who I'm in front of. I speak to everyone, whether it's a woman who is serving me in the cafeteria or whether they've asked me to go and speak to a congressional convening. And so I think if you're self-aware, I know what my limitations are, and I accept them. I know that it's a gift and a privilege to be a surgeon, and I remember that every day. And the thing that keeps me grounded is my parents and my friends call me Vikisha. And when your friends remind you that you're still that same girl that they knew growing up, then it's hard to be anything but humble and respect the fact that we have been given an awesome opportunity to enter patients' lives and be a part of their lives.
That was such an amazing answer from such an amazing woman. I really appreciate you. Thank you so much, Dr. Fripps, for coming on this show.
It's been my pleasure.
You have educated us. Our minds are expanded, and we are definitely appreciative. Guys, if you're listening to the Diva MD show with Dr. Shanika Williams, hey, make sure you download the Diva MD app. It is the Diva MD Healthy You app. You can check out live shows. You can check out previous shows, Facebook, Instagram, Twitter. Everything's on there. You can even schedule an appointment with me to be for your doctor's appointment. Check that out. Talk about skills. Guys, coming up next in the Divas Cafe, we have these 3 lovely ladies that are going to tell us their story of survival after being diagnosed with breast cancer. Make sure you tune right back in.
Hello, this is Leon Finney, your host of Another Perspective on UrbanBroadcastMedia.com. We are the voice of Black America. Join me and my guests every Saturday from 4 to 5 p.m. as we discuss the issues that impact Black America. Tune in to UBM Talk on UrbanBroadcastMedia.com, the simulcast on our affiliate station WBON 1690 AM. That's Another Perspective every Saturday from 4 to 5 p.m. And you can run and tell that.
Have you ever seen grandparents who are always on the move? Well, let me introduce you to Mr. Lorenzo Young, Miss Hermeline Jones, Miss Lenora Lusk, Miss Rose Henderson, Miss Doris Riley, and yours truly, Marie Johnson. Join us every Saturday morning from 11 a.m. to 12 p.m. on UBM Talk. Grandparents on the move, we don't rock, we roll.
Hi, this is Darian, the host of All Things with Darian King, heard every Thursday afternoon from 2 to 3 Central Time on UBM Talk. Every week, I'll be touching on a variety of topics that affect our lives and our faith. All things work together for good to them who love God and are called according to his purpose. Join me every Thursday, 2 to 3 on UBM Talk, so we can talk about a variety of issues that affect our lives and our faith. All Things with Darian King on UBM Talk, Thursdays from 2 to 3.
Hey everybody, check us out Monday from 7 p.m. to 9 p.m. for the new radio show Rated Life with
it's your boy Morris Spicer,
your boy Dex Pierce, Mrs. Just My Thoughts,
Pat Price,
and me, your girl Lex.
Lex, what are we gonna be talking about?
Everything is life, yes.
Wait, no, I ain't gonna do it.
Do it for Rated Life.
I ain't gonna do it.
Do it for Rated Life.
I ain't gonna do it.
Anyway, just make sure that you tune in to UBM Talk at UrbanBroadcastMedia.com and join our Rated Life Facebook page for more information. It's Rated Life, y'all.
ComEd presents the power of staying in the light. Having trouble juggling all your bills? Are you worried about the lights getting turned off? ComEd Care programs can help you keep the lights on. Care programs offer help to those facing financial hardships. All inquiries are confidential. To see if you qualify, visit ComEd.com/care or call 1-888-806-CARE. ComEd, powering lives. Grant amounts may vary while funds are available.
It's UBM Talk on UrbanBroadcastMedia.com. Call us at 312-754-4333 and get in on the conversation.
Hey, it is Dr. Shanika. You have tuned back into the Diva MD show. You have made your way to Diva's Cafe. Give yourself a hand. Okay, I'll give myself a hand to get y'all. In the studio with me today, I have three beautiful, lovely ladies. And these are my friends, guys. These are not just some random people I done pulled off the street to come talk on this show, but these are my buddies, people that I have known for years upon years. And what affects them affects me. So I'm sure there are many of you who have ever been either diagnosed with breast cancer or know someone who is diagnosed with breast cancer, have a first-degree relative, have a second-degree relative, your cousin, sister, aunt, brother. We forgot to mention in our earlier segment that men can also be diagnosed with breast cancer. So it's something that they need to be on the lookout for as well. But it affects everyone, especially in the African American community. And I wanted to give these ladies a chance to talk to you guys about, you know, what they have gone through, what their life has been like since diagnosis, and their wonderful story of survival. So, to my right, she's like, no, point to somebody else. To my right, I have Mrs. Lanita Digby Williams. Hello, my dear.
Hi, thanks for having me.
Oh, thank you for coming. Okay, I know her as Nene.
That's fine.
Okay, because I can't, Lanita, you know, that's just like Shanika, Nikki. that's what happens. But I have known this woman, oh my word, since we were 4 feet tall, standing on top of people's pyramids and cheering and dancing and flipping and tumbling and all that good stuff.
It's been a long time, a long ride.
Long ride. Abbott Park cheerleaders in the house. And then to her right, I have Miss Yolanda Pounds.
Hi.
Hey, Sunshine. How are you?
I'm good.
Now, this is my church, buddy. My church. We are in the youth ministry together. She has such a wonderful, wonderful heart. And she is an entrepreneur herself. Oh, so is Lanita. Nene.
That's
I'm
fine. Nene is
confused.
good. We're good with Nene.
So I have 2 young ladies that are entrepreneurs. You want to talk a little bit about what you do? Just a quick blurb.
Sure. I'm vice president of my family's business. We own Digby's Detective and Security Agency. So we're a second generation family-owned and operated contract security firm. We partner with government and private industries to address their security needs, usually through the use of unarmed and armed security officers.
Lovely. And that was Ms. Nene. And then Yolanda is an blogger extraordinaire.
Yes, and I'm just beginning my business to provide marketing for small businesses through blogging on social media. I'm sorry.
And she has actually featured me in one of her blogs.
Yes,
so when you guys get a chance, go to her page, Yolanda Pounds, LBS, not pounds, but LBS equals pounds.
It does.
Right?
Not laughing, but serious.
But serious.
Right.
LBVS.
And destinycalls.com.
Excellent.
Calls with a Z. And under putting you in touch, you'll find Shanika's story.
There you go. And to my left, I have Miss Carrie. Now, is it, okay, don't. I always call you Carrie Lockhart. But then on Instagram and Facebook, you somebody else. Okay, you Lockhart. This is Dr. Lockhart, y'all.
I hide out a little bit on social media. So.
She hides out. Okay, sorry. Don't look her up. Just playing, just kidding. And she is a pediatrician. Yes, and she is currently in between, but she's doing some great things in our community. So I'm very excited to have her on the show. Her best friend, we went to medical school together. See, I got to give y'all the background because you don't understand the story unless you know the backstory, as my friends Brenda and Rick McCain would say. So, ladies, who wants to go first and tell a little bit about their story with breast cancer? Yolanda?
Okay. I was 35 years old when I was diagnosed with breast cancer. The doctor spoke about this earlier, knowing your own body. I found my own lump because obviously I was not of age to have screenings yet, according to the guidelines.
Mm-hmm.
Exactly. So it was like literally at 3 a.m. in the morning. I laid down to go to sleep after a very long day, obviously. And for whatever reason, I just believe it was the Holy Spirit. I crossed my arms across my chest and something felt strange. And I thought, what is this? And I went to further investigate in the mirror, and I saw a lump literally protruding from under my arm. And my first reaction was to look on the other side. There was nothing there. And so, for about 30 seconds, I panicked, but I was too tired to worry. And I only had a little short window to sleep. I went to sleep, and I woke up the next day and shared the finding with my family.
Okay.
How far?
Okay. And then after that, did you make your way to the doctor soon after? Did you go through any type of denial? No, I'm not going to go to the doctor. I'm not going to.
Absolutely not. No denial. The next day was like a Friday, and it was chock full with things that I had to do. I didn't know where to start, in terms of which type of doctor to go to and all of that. So I made an appointment with my very difficult to get in to see gynecologist. And of course, when I went to see her on Monday, she was like, "Oh, you're 35. It's probably just this complicated mass. Don't worry. You're fine. I'm going to send you downtown to have some tests." And, pretty much reassuring me that probably no big deal. This happens all the time. It's probably a fibroid. And I'm like, okay. But at the same time, something was just like, it's a lump, So I did go downtown to have the screenings, and they did a fine needle biopsy. And the blood that came out was jelly-like, which I don't even know how I knew it was bad because it was jelly-like. So she told me even then I had a 95.5% chance that it was not breast cancer. And lo and behold, after seeing her and seeing a surgeon and him doing a biopsy of the actual tissue, I was waiting on a phone call, which was the longest cycle of life.
And I'm going to stop you there because I want to hear everybody's reaction to when they were told that this is what it was. So, Carrie, you want to go ahead and tell me a little bit about your story?
Sure. So I was diagnosed in 2011. I actually had found the lump, though, about 5 months before that, 5 or 6 months before that. And again, I think it's the same thing. Like, it was meant for me. God meant for me to find that. I was traveling after I graduated from medical school, and I was actually in Rome, and I couldn't sleep for some reason. I'm going to be heading back home, and I don't like to fly. So why I chose to fly across the Atlantic, I have no idea. But I couldn't sleep, so I decided to do a breast exam. In the middle, it was like 1 o'clock in the morning, and I was like, I haven't done one in a while. And I distinctly remember it being shortly after the recommendation had come out, and there was some discussion about needing to do clinical breast exams at home. And so I had gotten a little bit lazy, and I hadn't been doing them as regularly. But I had done them enough to know what was normal for me. And I felt this really firm area. It wasn't a lump or any, it just felt really firm and unusual. And I had some benign issues on that side before, so I'm thinking maybe it's just scar tissue. But it was enough that I was worried and text my mom back in the States, and I'm like, something's going on. I need you to make an appointment for me as soon as I get back.
Sure.
So when I got back, I saw my OB-GYN, and similarly, she didn't think it was much to worry about, but she was concerned enough that she said, I really think you should see a breast surgeon. And at the time, I had just finished med school. I was starting residency about 2 weeks after that, and so I wanted to wait until I was insured again. And so I asked her, was it okay to wait? And she's like, oh, yeah, 2 weeks is fine. No big deal. Well, anybody who's a resident knows that intern year of residency completely takes out your brain and everything else just goes away. So I forgot.
I don't think I got mine back.
Yeah, I don't think so. I didn't either. I haven't. So I forgot about it. I started intern year, and I was triggered just to get a checkup by a friend of mine who actually lost her battle to breast cancer that following November, who was younger than me. She was 30, a friend from med school. And so I just was like, I should just get a checkup, not thinking at all about this lump. So I went to get my checkup, and my doctor found the lump. And I mean, this is how bad it was. She's like, is this new? Have you had this lump already? And I really didn't even remember for a few seconds. I'm like, yeah, I think it's new. And then slowly things started to come back. And I was like, oh, yeah, found this back in June, but, I just didn't, it didn't seem like it was a big deal. I forgot about it. So we kind of started the ball rolling. And it's still unclear to me now if they, pushed me through so quickly because I was a resident with a tight schedule or if she was worried. Because she got me into the ultrasound the next day, the breast surgeon, and they did an ultrasound at the bedside, and they're like, this looks strange, not sure what it is. Let's do a real ultrasound. So I went for that. I'm still not worried. I'm thinking, no, this is probably the same thing it was before. No big deal. I was 33, so no family history. Really no risk factors except for the early periods and not having children yet. So there was those things, but nothing major. I didn't smoke. I don't drink heavily. So I'm thinking this is not breast cancer. So that same day for the ultrasound, they're like, this is unusual. We don't know what it is, but you need a mammogram. And so I think that's when I started to get a little bit nervous. I'm like, what is going on? And they did the mammogram. And again, they're like, this is inconclusive. Something's abnormal there. And so I asked them, I'm like, well, is this cancer? And they're like, we don't know, but we need to do a biopsy. And so I would have a biopsy on December 30th, 2010, and get a call on January 3rd, 2011.
Wow. So listen, guys, if you haven't learned anything else from the past two young ladies who have spoken, Yolanda and Carrie, is that these were very young when they were diagnosed. They were diagnosed at 35 and 33, both below the age of 40. The current guidelines is for women to be tested at the age of 40 or earlier if you have a first-degree relative. Did either of you have first-degree relatives?
I had an aunt who had what they described as non-genetic breast cancer, but nothing that would trigger me to get an
which
early.
is a second degree in that, know, in that respect. Yolanda, no?
I had an aunt and a paternal cousin.
Okay. So, we're talking, a generation down and under the age of 40 and under the recommended age for mammograms. So if you don't get anything else out of this, definitely know your body and definitely do self-breast exams. Nene?
So my story is pretty similar to the two stories before. I was diagnosed 6 days before my 34th birthday, so 33. And I actually found a lump when I was taking a shower, and it was just something that said, that's a little weird. Like something was off, but I didn't think too much of it. I went to my gynecologist as well, and they thought that it was some calcification from my milk because I gave birth the year before, so they thought it was just still the breast milk. But they did send me to the breast specialist. So I went there, and they did the ultrasound, the MRI. Then I came back, the mammogram, came back. They wanted to do the biopsy. And it was so quick, like back to back. So, of course, that can be scary because,
Absolutely.
If it's something wrong, they're going to try to speed up the process. But that biopsy was done, I believe, on a Friday. So I had to wait through the weekend and a couple of days out. And that was the longest weekend ever. Yeah, and I remember it was around the house picnic. It was actually that weekend of the house picnic. So I had plans to go to
that was a fun way to kind of.
And my little cousin's birthday party, and I just totally I just remember just not being in either one of them mentally. So that following week they called when I was at work, and that's how I got the news. Should I stop there? Or
No,
continue?
now
Okay.
you can continue.
Okay, so got the call at work. I was in my mom's office, and I just remember I was fine on the phone. After I hung up, I just stopped and just sat down and just started bawling. So obviously I needed to leave work. And I remember going running. Of all the things, running is something that I enjoy. I like the outside. And I just started bawling when I was running.
Needed an outlet.
Yeah. So after that, I just started planning. I just started praying. I started figuring out my support system. One of the things we haven't talked about, and the doctor didn't mention, and that involves stress. I really believe stress is a major contributor to breast cancer. So I was just trying to, eliminate as much stress as possible, which was hard because I did have a 1-year-old child, and I was still working, and no one knew, so I felt like I was going through this process by myself until I really got a handle on, just got a game plan. I feel like I'm a type of person where I need structure. So once I have a plan, then my mind can be at ease. So within a couple of days, I did feel at peace with everything. It was not an issue about whether or not I was going to die, because I feel like God allowed this. So, of course, he's going to use me as a testimony. But I also felt misunderstood. As much support I had, I used to tell my family, I want your support, not your advice. So that was a big issue that I had to go through. Carrie was actually one of the first people that I called. So she was very instrumental.
I didn't even know y'all knew each other.
So it was good to have other
God.
people, that could actually relate to what you're going through and just talk to, because it's me, of course, your family and friends want to be there, but they don't know exactly how it is and how it feels. And I wasn't in any pain, but just all the thoughts that were going on in my mind was it was good to have other people that I can call that has been through it and is living life beyond breast cancer.
So your support system is huge.
My support system was my saving grace.
Yeah, you have to. You can't internalize. You have to reach out to other people. Did you all reach out to other support groups or just family and friends?
I did
both.
I had this
Yolanda's shaking her head no.
I had a similar experience. My family, we're very close, a large family, but very close. And I felt so alone, though. People didn't really get it. And I'd like to say that when I first found out, I thought it was a blessing and I understood that this was God's plan. I didn't. I was very angry.
Sure.
You know, all I kept thinking is, I don't do anything. My vice is peanut butter. And I have breast
That's how I
cancer.
felt.
You know, I'm like, I don't understand this, you know.
Wasn't fair.
And so my family would just say, just pray, just pray. And one day I was just like, what do you think I'm doing? I'm praying. So I reached out to, at the time, it was an organization called Why Me, who about 2 years ago, disbanded. But they were my saving grace. There were women who were on there literally at 3 o'clock in the morning when I couldn't sleep. And I would go on the message board and just leave a message, and literally 3 minutes later, someone was saying words of encouragement and things like that. So it was, for me, it was my lifeline, you know, in the beginning. I think for a lot of survivors in the beginning, when you don't have a lot of information, it's very scary, and you're just trying to figure out your way. So that really helped me. They recommended support groups. I didn't really like that kind of group setting thing. But
so you did more of like an online.
And then I also reached out to Emmerman's Angels, which is an awesome organization that does one-on-one cancer support. And you fill out a questionnaire about what's important to you and a person that's going to support you, but it's another survivor.
Oh,
so
nice.
you can pick someone who's the same age, the same cancer, the same, all those things. And
so it's a general cancer website.
Yeah, for anyone with cancer. But
Okay.
they'll connect you with another survivor with similar cancer than like yours, similar age. And so it was those two things I think really helped me get through it. And certainly the grace of God, eventually now I can see it as a blessing because, I didn't have anybody my age to talk to. But when Nene called, I was like, I can answer. I know what this is like. I know exactly what she's going through. You know?
And at that point, did you feel like,
Oh, yeah.
now I see my purpose?
Yeah, for sure. I remember a nurse told me one day you might actually see this as a blessing. And I wanted to punch her, really.
Yeah.
She was a survivor also. And then I was like, oh, I guess she can say that, you know? And I do. I do.
Yolanda, tell us a little bit about, what happened when you were diagnosed. When, how did you feel? What outlets did you use? You didn't use any support system. Did you have family support?
I had family support. I didn't use support groups because I didn't want to be subjected to, I don't feel sexy anymore because I don't have not me, but someone else in the group that was dealing with that. Or, like the doctor spoke of, I'm bald now and I don't, feel this way or that way. So I didn't want that energy. So I connected strongly with my church, not through a program, but just through the teachings and the messages from my pastor at Salem Baptist Church in Chicago. And it really did help me because I didn't want to focus on what the doctor said or what the support group said. I wanted to focus on what God said. Sure. And so I just literally hung on to that with, both hands, feet, I just clamped on.
Yeah.
And that was my support along with my family and friends.
So where are you guys now? Like, did you all get treatment? Did you what happened? What was your course? And quickly.
I can start. I had surgery and that's all I had.
Okay. So when you say surgery, did you have a lumpectomy? Did you have a mastectomy? Okay. Did you get any of the reconstructive?
Yes, I have mastectomy and reconstruction.
Okay.
And I do need to just quickly mention my support group, and that's the Tasha C. Joyner Foundation. They were a big help. Every month we go to Pink Pillow Talk, and it's they're just a phenomenal group of African American women. They were so open and honest, even willing to show their scars, just take off their shirt and just be open and answer any questions. So just want to throw that in.
Very nice. And we're gonna talk about those three organizations again before we close out.
Okay.
I'm actually a 2-time breast cancer survivor. I was diagnosed in June 2001, and I had a lumpectomy. And in September 2001, I had a mastectomy. And that was really by he was going to try to do another lumpectomy. And I was like, you know what? This left boob offends me. Pluck it out. So I was just like, take it out. Nope, I don't want the mound as the doctor described it. Because I didn't want to cover up the problem area. So I just was like, and plus it was another surgery, and you want to cut somewhere else, no. So I just wanted the bad part out that could kill me, and I figured I would deal with the rest later.
Sure.
Oh, chemo.
Okay,
I
so
had
you
8
did get
courses
chemo.
of chemo.
Okay.
I was baldy locks, and I won't say I loved it, but I embraced it. I was, it gave me an opportunity to play with the wigs. I was Tasha one day, Vanessa another.
Yes, honey. You better work it.
Right, and I'm still playing with ponytails, So, and then I had radiation for 7 weeks.
Okay, good.
So my cancer was pretty early. So I just had they call it a partial mastectomy because initially they tried to do a lumpectomy, but it was too large, and so they had to go back in. No reconstruction, and then after that, because it hadn't spread beyond the duct, I only needed radiation for 6 weeks, and then I followed that up because my breast cancer was estrogen receptor positive. I started tamoxifen, but I had some really, really significant side effects, unfortunately, so I couldn't finish that.
Okay.
So right now I'm completely in remission, and I'm counting down to my 5 years.
Hey, you gonna have a 5-year party?
Oh yeah, with a cake and everything.
Clearly I need to be on that guest list.
Yes.
Okay, thank you very much.
what year is this for you, Carrie? So I'm going into, it'll be 4 in 2015 of January. So I'm just in the middle of my 3rd year.
She's already claiming it. Boom.
Yeah. Thinking ahead.
I'm right with her. She is a year and a half ahead. I love it. How many years are you in remission now?
2 years,
Nene. And then since 2008.
14.
You better work.
That's awesome.
That's what I'm talking
And
about.
I'm still 35.
Yes. How many anniversaries? It don't even matter. I know that's right, y'all. If you are just tuning in, sucks to be you, because this has been an amazing segment on breast cancer. Earlier today, we had Dr. Fripp with us, who is a plastic surgeon in Washington, D.C. And then we have these 3 lovely ladies, Lanita, Yolanda, and Carrie, who are in the studio with me today, and they're talking about their wonderful stories of survival. We have 3 years in remission. Tell me your
2 years.
2 years in remission and 14 years in remission. God is an amazing God, and he will do some amazing things if you just believe in his word. Guys, I'm going to tell you, about 1 in 8 U.S. women, about 12%, would develop invasive breast cancer over the course of her lifetime. In 2014, an estimated 232,670 new cases of invasive breast cancer were expected to be diagnosed in women in the U.S., along with 62,000 new cases of non-invasive breast cancer. That's in 2014. That's the expected. So, even though we're starting to see a decrease, we're actually... That's not what I want to say. What am I trying to tell you guys? We are seeing even though we're seeing an increase because of better detection, we're getting the mammograms. Women are doing self-breast examinations. Women are getting to the doctor. And also don't forget that men can be diagnosed with breast cancer as well. So please, if you don't get anything else from this discussion, please check your breast. Am I right, ladies?
Yeah.
Right.
Know your body, know and Dr. Fripp said it best. She's like, there's nothing that the doctor can tell me that's on my body because I'm already going to know, right? You need to know your body. So guys, this is the Diva MD show with Dr. Shanika Williams. Thank you so much for tuning in. Again, you guys can download the Diva MD Healthy You app, get all of my healthy app tips and all of my healthy tips and information about Facebook and Instagram and how you can listen to the show live and listen to previous shows. I mean, this app is loaded, okay? So make sure that you guys go to it. It's on Google Play. Download it today. Thank you so much for joining us on UBM Talk. And guess what? I'm going to see you guys next week, Saturday, 3 to 4 p.m. Don't forget, holla back.
I'm a diva.